Columnist and medical reporter for the Akron Beacon Journal and Ohio.com. And I am joined here by Dr. Ed Ferris. He is the chairman of the Obstetrics and Gynecology Department and the women's medical director of the Women's Health Department at Summa Health. Dr. Ferris, thanks for joining us.
Thank you.
You may have seen that on Saturday, Dr. Ferris and I worked on a column on women's health, talking about kind of prevention things that women can do through the decades. If you missed it, it was in Saturday's community section, as well as you can see it at my webpage, www.ohio.com/Betty. So today we just wanted to kind of highlight a few of those things and then talk to Dr. Ferris about a couple other items as well. We will also be monitoring Facebook Live here. If you have some questions that you want to ask us, we will try to answer those as we can as well. If we don't see them as we're going, we might be able to answer them in the comments afterwards too. So, Dr. Ferris, I just kind of wanted to go over a couple of the things. We're not going to rehash the whole column, but we'll just do some highlights. So, just kind of going through the decades, starting in the teens, you were talking about how often you start seeing girls age 14 to 15, and that the big thing to make sure girls know is that they do not have to have a pap smear or an exam, and that often scares girls.
Right. Yeah. So. Most really young girls, so under age 14, typically are seeing their pediatricians. Once they reach age 14 or 15 and their periods are happening and they might start getting interested in boys and stuff like that, it's important for them to get seen by an OB/GYN for their initial visit. There is no pelvic exam or really no physical exam that's typically done at that age unless there's some clinical concern or some history that's given that would warrant an exam. But typically it's a time for us to just introduce ourselves, what we do, what they can expect in the coming years. We talk about their periods, we talk about development, we talk about physical development, we talk about birth control, we talk about prevention of STDs, smoking, weight issues, healthy eating, immunizations, and so forth. So it's kind of a time for us to break the ice with them and give them a chance to get to know us, and then we see them usually on a yearly basis until age 21, and it's at age 21 that we usually will start doing some sort of a pelvic exam.
Okay, and then just speaking as a mother, and I know that there probably some parents would be pretty nervous about talking about contraceptives, and that doesn't necessarily mean that your kids are thinking about sex. Some girls need to be on contraceptives for heavy cramping or heavy bleeding.
Correct. Yeah. So most of the time, actually, in the teenage years, we are prescribing contraception for cycle control issues and painful periods. We are very careful to explain to younger women that just because you're on birth control doesn't necessarily mean that you should. It gives you a license to become sexually active. You still have to make the decisions. You still have to be responsible. We try to involve parents in those decisions as well, and so we can come to a good mutual decision about what to do.
Great. Great. And then moving on to the 20s, again, I'm just going to highlight a couple of these things. There were a lot more things that you and I kind of had in our checklist. But at age 21 is the start of pap smears, and again, more discussion of birth control as girls probably, or young women, get more sexually active.
Correct, yeah. So those two things, and then usually in the 20s is when a lot of women will get into more serious relationships. They may be thinking about getting married, so it's a good time for us to start talking about planning for a pregnancy and healthy things that you can do before becoming pregnant.
Okay. And then moving on to the 30s, breast self-exams. I know that one quote that you had in the column was that often people will say, "I don't know what I'm looking for," or "I don't know what I'm doing."
Correct. Yeah, and that's a very, very common response to when I ask the question, "Are you doing self-breast exams?" And so really the key is you want to become familiar with what your own personal breast tissue feels like, so that if you do develop a lump or something changes, that hopefully you will recognize it and be able to bring that concern to your physician.
Okay, okay. And then other things in the 30s, pregnancy planning, and changing metabolism and exercise. I know we talked a little bit about once you have those kids, and then you're guilty of finishing the chicken nuggets on the plate,
right.
and just being so tired that you don't want to go exercise.
Yeah.
That can also sometimes be, with your changing metabolism and the extra weight that you've put on, can kind of end up being an issue.
Right, correct. So I think one of the things that I've seen over the years is that, women, they get pregnant and they gain whatever amount of weight they gain during their pregnancy. They don't ever really truly get all that weight off, and then they get pregnant again, so they gain more weight. And so after they've had 2 or 3 kids, they could easily be 25, 30, 40, 50 pounds overweight. And so it's really important in between pregnancies to get back down to your pre-pregnancy weight or a healthy weight, so that you're not fighting an uphill battle after your childbearing age or years are done.
Sure. And I'm sure there's ways to exercise with the baby, use the baby as weight bearing,
Right.
go find a gym with a daycare, or find classes that you can do with the kids.
Yeah, correct. And exercise during pregnancy has never been shown to be adverse to the pregnancy. If there was, if you had some medical condition during your pregnancy that would prohibit exercise, your physician should talk to you about that. But by and large, if your pregnancy is healthy and everything's going fine, there's no reason why you can't exercise, with some limitations as your belly gets bigger. But you should continue to exercise and eat healthy, so that you'll bounce back quicker and hopefully get back to your pre-pregnancy weight faster.
Okay, great.
Yeah.
Moving on to the 40s. This is kind of when you start your screenings, such as mammograms, every other year if you're healthy. I know you and I discussed that if you have some family history, you might want to start a little earlier.
Right, so a strong family history, multiple family members with breast cancer, family members that had breast cancer at a younger age, typically under 50, we usually recommend screening a little sooner than age 40. If you do not have any family history, then age 40 is generally accepted time to begin mammograms.
Okay. Can you also discuss, is this something that you want to discuss with your doctors about some of those hereditary tests that you can take?
Yeah, so there's lots of research being done on hereditary breast cancers and hereditary cancers in general. And a lot of physicians, especially in the Akron area now, are learning what those tests can do. And so we do have the ability to offer patients that look like they're at high risk for some sort of hereditary cancer to be screened early, and that can help to kind of guide a comprehensive plan to help reduce their risk for cancer moving forward.
Let's also touch on, I know I've told you this and I mentioned in the column, I have friends who are scared to death of a mammogram and haven't done it. And I keep trying to encourage them and tell them, how important it is. Can we talk a little bit about that and a little bit about what somebody might expect in a mammogram?
Yeah, sure. So it's a great question. I mean, the key to any cancer is to catch it early. And mammogram is, for breast cancer, mammogram is the best way of catching it early. It can be uncomfortable, but what I try to explain to my patients is that that 10 or 15 minutes of uncomfortable feeling during the exam pales in comparison to not diagnosing a cancer early, and all the treatment that you have to go through, surgery, radiation, chemotherapy, etc. The pain of all those experiences will far outweigh the screening process.
Right. I know that there's some controversy too to false positives, and sometimes there are just going to be some false positives as well.
Right, so sometimes there are things that are seen on mammogram that we can't clearly identify as being benign or cancerous, and so that can lead to extra testing and possibly some biopsies, and everything ends up being okay. But even that is, just part of the process.
Possible early detection.
Right.
Okay. Other things in the 40s is starting to do cholesterol, high blood pressure screenings, as well as a dermatological screening, perhaps with your primary care
Right,
physician.
and I think the dermatology thing is probably one thing that's a little bit underutilized. There are lots of people that are fair skinned that are at risk for developing some sort of skin neoplasm, and they should be having their moles in their skin looked at on a regular basis.
Okay. Moving on to the 50s, that's the start of the colonoscopy, and that is yearly or every other year?
So colonoscopies start at age 50. They're usually every 5 to 10 years,
Okay.
depending on your risk factors and your family history and whether anything is found at the time of your colonoscopy. And whoever does your colonoscopy could kind of guide you as to how often you personally would need it. Sometimes we do screen earlier than age 50 if there is a family history of colon cancer or hereditary polyposis, which is another thing that puts you at risk for developing cancer. cancer.
Okay. And then we talked about increased calcium and vitamin D intake, 1,000 to 1,300 milligrams of calcium per day. I believe you said 500 milligrams at a time with food for absorption.
Right.
And then 400 to 800 international units or IU of vitamin D.
Correct, yeah. So osteoporosis screening is definitely something that all women should be cognizant of, and depending on family history, again, we may screen you earlier or at the recommended time, depending on your risk factors.
Okay. And then in the 50s, mammograms go to yearly.
So in the 50s, yeah. So we can do mammogram screening every 1 to 2 years in the 40s, definitely yearly at 50.
Okay.
We continue mammogram screening through your 60s into your 70s. Once you hit around age 75, there is a discussion that should be had with your practitioner about whether or not you should continue mammogram screening or not, and that will just kind of take into your overall general health and life expectancy and those sorts of things.
Okay. And then also, I'll touch on this, and then I want to come back to it after we finish our decades, is the average age of menopause is 51.
Right.
But we'll put a pin in that and come back to that in a second. Going on to the 60s, osteoporosis, bone density screenings, stopping pap smears at 65 if you are healthy.
Right, so age 65 is generally when we will stop doing pap smears if you've not really had any significant abnormal pap smears in the last 20 years. If you've had a hysterectomy for reasons that had nothing to do with a cancer, then we also stop doing pap smears after a hysterectomy as well.
Okay. And then 70s and beyond, I think you actually already mentioned stopping colonoscopies and mammograms at 75 if you're healthy. Watching for stability issues and signs of dementia. And the importance of just staying mentally and physically fit and aware.
Right, yeah, so I mean, people are living longer and longer, and there's no reason to stop exercising as long as your physician thinks that you're safe to continue to do that. Try to keep your mind active, and if you personally are concerned about your memory, or you notice, family members notice significant issues with your memory, then you should probably get some sort of mental acuity screening to see if you might be at risk for dementia or Alzheimer's or something.
Okay. And then going back to menopause, so the average age is 51, which average obviously means, before or earlier.
Right.
I know one question I had asked you when we were just talking was, does it have anything to do with your mother's history? Or, if your mother went through menopause at 40, does that mean that you will go through that?
Yeah, not necessarily. I mean, so most women do tend to follow what other women in their family have done, but it's not a guarantee that you'll follow in their footsteps. So you're your own unique individual. You have to kind of assess each patient as they come in.
Mm-hmm. And can you talk a little bit about symptoms? Because it sounds like for some people they're symptom free. Other people, they can have symptoms, and they can have symptoms on and off for a long time. So how do you know when you might be is it perimenopause? I mean, how do you know when you might be starting down this journey?
Yeah, so you're exactly right. So it runs the gamut. Some patients are relatively asymptomatic as they go through menopause. Others, actually are suffering pretty significantly from their symptoms. Their symptoms include things like insomnia, hot flashes, night sweats, vaginal dryness, mood swings. Typically, we don't consider you menopausal until you've gone in a full year without a menstrual cycle, and those symptoms can be kind of go along with your periods changing and eventually stopping. So once you've gone an entire year with no period, we really should not bleed again after that, and if you do have any bleeding after menopause, you need to bring it to somebody's attention, because that can be an early warning sign of something going on within the uterus.
Okay. And then again, I'm sure it runs the gamut that, the definition is 12 months, but it could be that your flow, ends up being different, not typical of what you're used to.
Yeah, so the flow definitely can change, the regularity of it can change, the length of time that you have a period can change. You can start to have periods very periodically, so they could, you might miss 2 or 3 or 4 at a time. If that goes on for several years and we are having a hard time distinguishing, are you truly in menopause or are you just still perimenopausal, then there are some tests that can be done to kind of determine where you're at in the cycle and whether the fact that you're still having bleeding is okay or not.
And then you do consider it 12 months in a row. So I could go 10 months and then have a flow and then start that clock over again?
And you start that clock over again, so then the question becomes, is that bleeding that you had at 10 months, is that still part of the perimenopause, or is that something that may be a warning sign? And so your doctor can kind of go through that with you.
Okay, and then can you discuss hormone replacement or antidepressants? I know that that's sometimes been some controversy there.
Yeah, so hormone replacement therapy and antidepressants are sometimes used to help with menopausal symptoms. There are certainly times when there may be contraindications to the use of hormone replacement, and your doctor will be able to go through that with you. But generally speaking, if you have had breast cancer or some sort of blood clot, those are two examples of reasons why you might not take hormones. Hormone replacement is controversial with regards to whether or not it truly predisposes you to breast cancer or not. There's some conflicting data about that. Generally speaking, I think it's safe, especially in short intervals. Gone are the days when we put everybody on hormone replacement. Now it's a very individualized therapy, and risks and benefits need to be discussed with your provider to see if you're a good candidate for hormone replacement. If you're not, antidepressants can be an alternative.
Okay. So it sounds like really for any of these things in any of your decades, you really should be making decisions and talking with your OBGYN.
Yeah, I think so. I mean, I think your doctors are there to provide you information so that you can make a good decision together, and then adjust that plan moving forward if things change.
Right, great. I'm going to do a quick check, see if there's any questions on Facebook Live. Okay, great. Thank you very much for your time.
Thank you.
I appreciate it.